It's a scary thought. The potential of losing Medicaid, the potential of it being cut down or cut entirely. It feels like there is a hidden price tag on my life and my life's worth.
Slater is among millions of Americans who may be at risk of losing their Medicaid coverage. The Congressional Budget Office has estimated that 10 million more people will be uninsured in 2034 because of the tax bill signed by President Trump this summer. Researchers recently looked to past studies to predict what this will mean for patients. Their findings were presented at a Senate committee hearing, and updated numbers were provided to the Associated Press.
As a consequence of this bill, 2.5 million would go without their personal doctor. 1.7 million would not get needed medications. 1 million wouldn't have their blood cholesterol checked, and that about 500,000 women would not get needed mammograms. 1.6 million Americans would accrue medical debt. Finally, most disturbing of all, we find that more than 20,000 Americans would die as a result of this bill.
I was originally diagnosed with chronic lymphocytic leukemia and small lymphocytic lymphoma when I was 26 years old in 2018. And most recently, it came back in November of 2024. I also am a diabetic. If I didn't have health insurance, my medication alone is $15,800 and something a month. That doesn't include going to a doctor, getting blood work.
Slater has already seen the impacts of what being uninsured or skipping her medication could mean. In May, she went 4 days without her cancer medication and ended up in the hospital. And going without health insurance last year caused her to ignore early signs that her cancer had come back.
If I had been covered when I first started feeling the symptoms, I would have gone to the doctor. I'd be in a completely different space.
We are putting patients in a terrible position. They're left with a choice between getting care they can't afford and potentially accruing devastating medical debt, which can even lead to bankruptcy, or asking them to go without needed care. There's really no questioning the basic reality that you can't take health care away from 10 million people without causing many preventable deaths.
I'm only one example of the type of person that gets Medicaid. Once we start to define who gets Medicaid, isn't that just a really nice way of rephrasing who deserves it? And once we get to that, who does deserve Medicaid? Who deserves health care?